When thinking about menopause, we know that all women go through a multitude of changes with their bodies. Menopause, simply put, is a life transition where we are going from menstruating or cycling so that we can bear children into not. So normally this is going to be just a huge shift in hormones that we have readily available to us. We know that with that, the body changes that we experience. One of the biggest one is going to be actually pelvic floor changes. So many women during menopause and after report things such as an increase in urinary incontinence, an increase in pelvic organ prolapse, as well as an increase in sexual dysfunction due to vaginal atrophy. Here at PeakRx, we've said it before, is we want women to be able to thrive through life's transitions. We don't want to sit back and let menopause happen to us, but we know that there are very clear, direct things that we can do to kind of take on menopause head on. And one of those things is going to be adoring your pelvic floor. So what we're going to talk about is 3 things that you can do to make sure that you are treating your pelvic floor well to minimize those risks or minimize those symptoms before, during, and after menopause. So to understand a little bit about how we can care for our pelvic floor well, we need to understand what our pelvic floor is. So it is a group of muscles that's going to be at the bottom of our pelvis. So when we talk about our pelvic floor and the changes that we go through menopause, yes, we're talking about muscles, but just as much we're talking about what we call is passive structures. So things like fascia and ligaments also make up our pelvic floor. So this is the bottom of us. This is what supports our organs. This is what closes our holes, as well as aids in sexual function. We know that just with aging, strength decreases 5% per decade, strength in muscles. So this is why it's really important that all aging people take part in resistance training or strength training. This is a good way to beef up all of our muscles, but specifically our pelvic floor. So we know that some part of this is going to be addressing the strength of our pelvic floor. But then we also know that there are some changes that have nothing to do with the muscles, but everything to do with everything else, all of those passive structures. So here, the main changes that we're seeing are hormonally. When we have a shift in hormones, we're going to see some changes in our skin and the way that our bones are held together and all of that. And our pelvic floor doesn't get a pass on those changes. So what are 3 things that you can do to adore your pelvic floor during menopause? Number 1, we already touched on it, we need a strong pelvic floor. So if you aren't already taking part in a very specific pelvic floor strength training program, we advise premenopausal and menopausal women to get going on this. This is something that we believe needs to be what we call accessory work, meaning maybe not something that takes up your whole week, but something that you consistently do a couple of times a week for the long haul. We know that doing this, being consistent with it and doing it well aids in the decrease of urinary incontinence, which is going to be loss of urine, as well as a decrease in pelvic organ prolapse incident. So we have a few options for you guys and a few resources on Kegling and pelvic floor strengthening. And we always suggest going and learning how to do a Kegel correctly from a pelvic floor therapist, and that a lot of women tend to not do this well. We don't believe this is something that you can learn just through a pamphlet, and that we really hope and see that specific pelvic floor education and training is really how you're going to get most bang for your buck. Number 2 is going to be make sure that you have happy hormones. I think this goes kind of without saying. So already on the medical side of menopause, we have things like hormone replacement therapy, and we know that all of those things are good and great, and that we need to be supplementing the hormones that we no longer have in our body. And so making sure that that's something that you're talking to your doctor about. The other thing that we know, as opposed to systemic hormone replacement, is going to be specific vaginal use of estrogen. We see that the application and use of vaginal specific estrogen is a great way to decrease the incidence of all 3, urinary incontinence, pelvic organ prolapse, as well as the burning sensation, the atrophy, and the loss of sensation sometimes that we have vaginally with menopause. So making sure that you're doing things to address the hormones in your body. This can also be things like supplements and nutrition. We encourage all women who really want to get to know their bodies and take advantage of menopause to work closely with nutritionists as well as functional medicine doctors to really get at the why for them specifically, as well, other than just looking at medically replacing hormones. And then lastly, Another wonderful way to support your pelvic floor during menopause is going to be looking at lumbopelvic stability. And that's a fancy word of just strengthen your butt, make sure you have good balance, and make sure you have good hip mobility. Our pelvic floor can be a slave to those things, in that it's tucked away on the inside and we don't really pay attention to it, but it can be masked and it can be suppressed by tight hips. It can be exposed and it can maybe have to work harder than it needs to because we don't have glutes that are firing properly. So this is where we, again, encourage all aging people, but specifically menopause participants, to take place in a full body resistance and strengthening program. So we understand that, and we hope that you understand that this isn't just, lifting heavy weights. Resistance training can look a lot of different ways, but making sure that you're seeking that out and really working on beefing up your muscles everywhere throughout your whole body will generally make you feel good, but specifically help to adore that pelvic floor. So we've got pelvic floor specific strengthening, we've got happy hormones, and we've got lumbopelvic stability and full body strengthening are 3 great ways that you can thrive through menopause and live your best life.